Hi, I am Dr. Jayanti Kamath. I am a IVF consultant, obstetrician and gynecologist practicing for the last 20 years. I am practicing at Srishti Fertility Care Center and Women's Clinic. So today I will be talking about what to do if you are planning to have a baby but have a difficulty in conceiving. If you are married for more than 1 year, you have been trying for a baby for more than 1 year, having regular sexual intercourse and not using any contraceptive, then it is defined as infertility. At that time you should seek the help of an infertility specialist, or if the woman's age is more than 35 years and if she is married for even 6 months, she should seek the services of an infertility specialist. So why do we say the age of 34 years or 35 years is important? That is because after the age of 30, a woman's reproductive capacity keeps on declining. So when a woman who is over 35 years, it will affect her quality of oocytes, the quantity of oocytes, and even if she gets pregnant, there are more chances of genetic abnormalities in the baby like Down syndrome. Besides this, she can have complications in a pregnancy like pregnancy induced hypertension, gestational diabetes, preterm delivery, premature rupture of membranes and difficult labor. So age is very important as far as infertility management is concerned. Now, why is infertility increasing as of today? That is because of increasing age of marriage, postponement of childbearing, increased incidence of sexually transmitted diseases. Women today are very much into the workforce and they want to settle their career before they are planning to marry or even have a baby. Now there are two types of infertility, that is, one is primary infertility when a couple has never conceived, and secondary infertility when the couple has conceived a child. Maybe it could be an abortion, it could be a miscarriage, but they cannot conceive again. So when you go to an infertility specialist, what do you expect? Firstly, the doctor will take a detailed history of your age, your lifestyle habits, and the number of times you have relations in a week, any previous treatment, any previous illnesses, etc. For the woman, a detailed menstrual history will be taken. So menstrual history, like the date when you had the last menses, whether your periods are regular, what is the interval between the periods, what is the blood flow during the periods, is it less, scanty or excessive, or is it painful, or do you have pain before menses? All these things will be asked. It is very important for a woman who is planning to conceive to keep a detailed menstrual calendar. So today we have a lot of apps on your mobile, so it is very easy to keep track of your menstrual cycle. Then the doctor will ask you about the number of times you have relations in a week, then about your lifestyle habits, diet, etc. The next will be a physical examination. Now in this physical examination we have a general examination and your specific examination. So general examination will be, the doctor will examine your blood pressure, pulse, whether you have anemic or whether you are in the best of health. Then the specific examination will be a per vaginal examination. So after finishing this, she may advise you ultrasonography. Ultrasonography is to know the structural defect in the uterus, and as we all know that tubes, the reproductive system in a woman consists of a uterus, the tubes and the ovaries at the sides. Now all of us know that these tubes play a role in reproduction because they are the ones which transport the oocytes, and fertilization takes place inside the tubes. The tubes are very important. So we cannot make out whether there is a block in the tubes or not just by doing a plain ultrasonography. So there are specific tests for that, and those tests are, one is hysterosalpingography, wherein a dye is injected inside the uterus and then an X-ray is taken to know whether the tubes are blocked, whether they are patent or not. In some certain cases, when the doctor feels that they need more information about this, he may advise you a hysteroscopy. Hysteroscopy is when we put an endoscope inside the uterus through the mouth of the uterus and see the inside part of the uterus. So, what do we see there? We first see the openings of the tubes, whether the uterus is normal, whether it has a septum, whether there is a polyp, whether there is a submucous fibroid. So, all these things can be seen. Laparoscopy is we put in another endoscope through the umbilicus of the woman to see whether the tubes are patent, whether the shape of the uterus is normal and whether the surrounding organs are normal. Now, this procedure of hysterolaparoscopy is preferably done under general anesthesia. At the most, the woman will have to stay for a few hours in the hospital, or she can stay for one whole day based on a comfort level. Then the doctor will also advise certain blood tests. Certain blood tests, one are the general blood tests, that is the hemoglobin, the urine routine microexamination and a few other tests, and a specific blood test such as FSH, LH, serum prolactin, your thyroid stimulating hormone, then AMH. So, all these tests tell us the capacity of the woman to produce eggs and the hormonal status in a body. If you need any help in trying to conceive, you are planning to conceive, you are trying to conceive for more than 1 year, but you have not gained any success, please contact me at lybrate.com.